The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello, everyone. This is Karen Nickel, family nurse practitioner, and this is Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. Before we get started today, I want to remind you about my course called The Perimenopause Answer. If you are going through this phase of life called perimenopause, or if you don't know if you're in perimenopause, I would love to have the opportunity to talk to you about the course to see if it's the right fit for you. There is a link on our website, itchyandbitchy.com, and our Facebook page, I&B Podcast, where you can schedule an appointment for a Zoom call with me. This is a Zoom call with me. When you make an appointment, I will be sitting at my desk waiting for you to join the one-on-one Zoom call. A young woman who is the daughter of a friend of mine reached out to me a few weeks ago with a complaint of recurrent bacterial vaginosis in spite of treatment with appropriate prescription medicines. I was slightly disappointed that her provider had not given her any additional therapies or recommendations to alleviate her constant symptoms when the antibiotics just weren't working for her. So once again, I thought, maybe my listeners are dealing with this same problem and can't get recommendations beyond prescription antibiotics. So today is Vagina Day. What is bacterial vaginosis? If you have a vagina, there is a high likelihood that you have had or will have a vaginal bacterial infection in your lifetime. Although a vaginal bacterial infection called bacterial vaginosis is most prevalent among women of reproductive age, with 35% of women of this age affected, 17% of postmenopausal women also experience BV. Bacterial vaginosis is a vaginal infection that occurs when bad bacteria take over the good bacteria in the vagina, known as lactobacillus. And the bad bacteria takes over the vaginal environment. So what are the symptoms of BV? Well, here's a very scary statistic. Up to 84% of people with BV don't have symptoms. If you do have symptoms, those can include an off-white, gray, or even greenish-colored vaginal discharge, and it's usually really watery. Sometimes it can feel like you're peeing in your pants. Fishy-smelling vaginal discharge, especially after sex. I know, it's getting better and better. Vaginal itching or irritation, a burning feeling when you pee. Well, so how do we get BV? Well, we'll start with what doesn't cause BV. You cannot get BV from hot tubs, swimming pools, or toilet seats. You also cannot get BV from touching a surface that a person with BV has touched. So just put those out of your mind. Experts don't totally agree on BV causes, but there are several factors that may increase your risk of BV. And those are if you're pregnant, if you don't use condoms or a barrier device, if you have an intrauterine device, an IUD, if you have multiple sex partners, or if you have a new sex partner, or if you have a sex partner who also has a vagina. Also, if you use douches, you have increased risk for BV. And if you are taking antibiotics, that also increases your risk. According to the CDC, BV is more common in sexually active people. However, researchers do not understand exactly why. Yet another female medical issue mystery. We're abounding in them. The list I just gave you of factors that increase your risk of getting BV likely do so because they change the pH balance in the vagina. A normal vaginal pH is 4 to 4.5, so moderately acidic, but this can vary among women. A 2021 review noted that a healthy vaginal pH can range between 3.8 and 5. This acidic pH level can help protect against bacterial and fungal infections. That is why the vaginal area is acidic. What is considered a normal vaginal pH level also varies by age. A person of reproductive age has a normal vaginal pH between 4 to 4.5, while women who have yet to begin menstruating or who have gone through menopause may have a normal vaginal pH higher than 4.5. Lactobacilli bacteria, the good bacteria, live in the vagina and secrete lactic acid and hydrogen peroxide, which give the vagina its acidic pH level. It's supposed to be that way. There are certain things that can raise the pH in the vagina. A higher pH or alkaline level allows an increase in growth of opportunistic bacteria like Mobiluncus. Do you love that name? Mobiluncus. Some interesting bacterial names. Anyway, when these opportunistic bacteria like Mobiluncus or group B strep or trichomonas are present in the vagina, they overpower the lactobacilli, the good vaginal bacteria that keep the pH low. So with low levels of lactobacillus, the pH starts to rise. The bad bacteria thrive in a high pH, so more and more bacteria are allowed to grow. It's a vicious cycle. The presence of menstrual blood also raises the pH. Blood has a higher pH than the vaginal environment, and when a person is menstruating, the presence of menstrual blood can increase the vaginal pH level. Many of my patients complained of BV type symptoms immediately after they had their period. Semen is very alkaline with a pH of around 8, which is the opposite of the vagina's acidic environment. When semen is present in the vagina, it can temporarily increase the pH and allow bad bacteria to grow. Taking antibiotics will also goof up the acidic vaginal environment. Antibiotics kill harmful bacteria, yay, but they can also kill good bacteria, and this includes lactobacillus, the good bacteria in the vagina. If a person is taking antibiotics, the vaginal pH can get out of balance. So, is BV contagious? Or is it a STI, a sexually transmitted infection? Well, bacterial vaginosis isn't contagious, meaning it doesn't spread from person to person. Also, bacterial vaginosis isn't sexually transmitted, but it is linked to sexual activity. Sex may change the bacterial environment in your vagina by changing the pH, which in turn makes bacterial overgrowth more likely. As I said, semen is a very alkaline substance that can change the pH in the vagina. As I mentioned before, experts don't totally agree on what causes BV, but we have a couple of recent studies that may provide one explanation that may show that there may be some sexual transmission component. A lot of maybes. A 2023 study suggests that the bacteria causing BV may be transferable from women to men during sex, and researchers are exploring whether men can transmit it then back to women. One 2020 study shows that bacteria causing BV can live on the penis or in a man's urinary microbiome. There it sits. In the study, a significant number of women developed BV within 6 to 12 months after having sex with men, suggesting that bacteria associated with BV were transmitted to the women from the men during sex. Men don't actually get BV, it's bacterial vaginosis. They don't have a vagina, but they can transfer the bacteria into the vagina during intercourse. And when they have BV present on the penis, they do not have symptoms. They don't have bacterial infection symptoms. If both you and your partner have a vagina and one of you has BV, the other person will likely need to be treated as well. We're going to take a little breaky poo from all this vaginal talk, but I'll be back with more BV info in a minute. Stay with me. welcome back. So, what is the testing for BV? Well, there is not an over the counter test for BV. Like we have some for UTIs and we have some for yeast infections, but we do not have an over the counter test for BV. If you are having symptoms, you should notify your provider who will see you for the problem, take a full history, do a pelvic and speculum exam to look for signs of infection, and they can also take a sample of the discharge and look at it under a microscope to check for bacteria. That test is called a wet prep. They may also check the pH of the vaginal discharge. They can also do a test called a whiff test, which is just what it sounds like. This is when the provider checks for a fishy smell. I know, it sounds a little icky, but it's all part of the exam. If you have an exam and it is positive for BV, typically BV is treated with prescription antibiotics, usually either metronidazole or clindamycin. These medications come in a gel or cream that you insert into your vagina once daily for 7 to 10 days, sometimes as few as 3 days, but usually 7 to 10 days. Usually that dosing will take care of the problem, but about 10 to 15% of people need another round of treatment. In my practice, it seemed a little higher than that, but that is the statistic that we have. If bacterial vaginosis symptoms come back soon after your treatment, you may want to return to your healthcare professional to consider alternative treatments. Options include different or extended drug therapies or adding probiotics that replace the good bacteria in the vagina and or using boric acid suppositories, which I'll talk about in a minute. The antibiotics can also be prescribed in a pill form that you take by mouth, but this method of dosing can cause some more side effects than the gels or the creams. Also, if you take metronidazole by mouth, you will be instructed not to drink alcohol while you are on the medication and for a few days after finishing the med. If you drink alcohol while on metronidazole, it can cause significant nausea and vomiting. Not good. There are some non-prescription treatments for BV. Boric acid vaginal suppository is one treatment option. These are available over the counter. You insert the suppository once daily for 7 to 10 days. For more severe infections or recurrent infections, inserting one suppository twice daily for 7 to 10 days is often recommended. Boric acid suppositories can be found over the counter, as I said, at most pharmacies. They're readily available. Again, addition of a probiotic that replaces the good bacteria in the vagina is always a good treatment addition. I'll give you a good example of one in a little bit. You can have BV more than once in your lifetime. As a matter of fact, up to 80% of people get bacterial vaginosis again in their lifetime. And those of you out there who have had recurrent BV are screaming, "Yes, I know it, Karen. Had it over and over and over again." There are some risks to having untreated BV. If you're pregnant and have BV, it may lead to premature birth, miscarriage, infants with low birth weight, or infection of the placenta and amniotic fluid. If you are pregnant and have BV, it should be treated right away while you're pregnant. There are antibiotics that can be used to treat BV that are safe in pregnancy. So if you have symptoms, let your OB know right away. BV increases your risk for STIs, sexually transmitted infections, including chlamydia and gonorrhea. If you have HIV and develop BV, you're at higher risk for passing HIV to your partner. Research shows that BV can cause up to 6 times more HIV shedding in someone who has HIV. Shedding refers to the amount of virus present in bodily secretions. Increased shedding can put your sexual partner at a greater risk of contracting HIV during sex, even if you are taking a medication for HIV. BV can cause pelvic inflammatory disease, PID, which is an infection of the reproductive organs in your pelvis. Untreated, PID can lead to difficulties getting pregnant. There are some things you can do to prevent BV. Yay. If you've noticed that your symptoms often occur following your period, boric acid suppositories can be inserted vaginally once daily for 2 to 3 days after your period to reset the pH in the vagina. Taking a probiotic that is designed specifically to replace the good bacteria in the vagina is a great way to promote vaginal health. A good example of a vaginal probiotic is Garden of Life's Raw Probiotics Vaginal Care, and you take 1 cap orally once daily, so it is an oral capsule. Other prevention measures include avoiding perfumed menstrual products like tampons or pads. Wear breathable cotton underwear that isn't too tight. I know that doesn't sound sexy, but if you're having issues with BV, it will be worth wearing those cotton underwear, trust me. Change out of tight, sweaty clothes as soon as you can. So if you have tight, sweaty gym clothes or you've been running and have your tight leggings on and they're sweaty, get them off as soon as you possibly can. Avoid douching. You're just flushing out the good bacteria that is in the vagina when you do that. Don't do that. Use condoms or other barrier methods when you have sex. Limit the number of sexual partners you have and avoid spreading bacteria from your gut to your vagina by wiping front to back when you go to the bathroom. I know we learn this when we're children. Hopefully we don't learn that when we're children, but it's good to be always to be reminded of that. Back to the young woman who contacted me about her recurrent BV in spite of treatment with antibiotics. When she contacted me, I shared with her the information about using boric acid suppositories to treat for 7 days, then using them for a couple days immediately after her period. I also recommended changing her general probiotic to the Garden of Life Vaginal Care probiotic to take once daily by mouth. I also reviewed the other prevention measures I shared with you in this episode. She let me know that within 2 to 3 weeks, all her symptoms had resolved. Great news. I hope this episode helps you as well. Thank you for listening to and for sharing the podcast with others. Wherever you listen to this podcast, please leave a review and rate the podcast. Your reviews and ratings really do matter. I encourage you to visit our Facebook page, INB Podcast, where you can leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. On the Facebook page and website, we have the information about how to schedule an appointment with me. Again, it's not a webinar, so that we can chat about how my perimenopause course can help you if you're going through this phase in life. As always, thanks to Forrest Winsel, my son, our producer and composer of our theme music, and the person who does all the behind the scenes work to make this podcast possible. Thank you, Forrest. As I mentioned before, our Forrest has moved to Baltimore to attend the prestigious Peabody Music Conservatory, where he has begun his studies to receive a master's degree in music composition. My husband and I just returned from Baltimore, where we heard Forrest's first composition written and performed at Peabody. He's written many, many compositions, but this is his first one at Peabody. It filled my heart with joy to hear his amazing piece of music and to see him in his element. Remember that your health is in your hands.